Leg cramps, those sudden, involuntary, and often excruciating contractions of leg muscles, are a common and distressing issue for many seniors. While they can strike at any time, they are particularly notorious for interrupting sleep, leading to discomfort, fatigue, and a reduced quality of life. The causes of leg cramps are multifactorial, ranging from dehydration and overuse to underlying medical conditions and certain medications. However, a significant contributor often lies in nutritional deficiencies, particularly imbalances in key electrolytes and minerals crucial for proper muscle function. By strategically incorporating specific nutrient-rich foods into their daily diet, seniors can effectively mitigate the frequency and severity of leg cramps, thereby promoting stronger, more resilient legs and overall well-being. This comprehensive guide will delve into the top 3 food categories that are exceptionally beneficial in preventing leg cramps in seniors, providing detailed explanations of their mechanisms, specific food examples, and practical tips for seamless integration into daily meals. 1. Potassium-rich foods, the essential electrolyte for muscle harmony. Potassium is a powerhouse electrolyte, playing an indispensable role in maintaining cellular fluid balance, nerve signal transmission, and, critically, proper muscle contraction and relaxation. It works in delicate concert with sodium to create an electrical gradient across cell membranes, a process fundamental for muscles to perform their functions smoothly. When potassium levels drop below optimal, a condition known as hypokalemia, muscle cells can become hyperexcitable and prone to uncontrolled contractions, manifesting as painful cramps. Seniors are particularly vulnerable to potassium deficiency due to several factors, including medication use. Diuretics, commonly prescribed for high blood pressure and heart conditions, can increase potassium excretion. Decreased appetite and varied diet. Seniors may consume less diverse diets, leading to inadequate intake of essential nutrients. Reduced absorption. Age-related changes in the digestive system can impair nutrient absorption. Why potassium is paramount for leg health. Muscle contraction and relaxation. Potassium is directly involved in the biochemical processes that enable muscles to contract and, equally importantly, to relax effectively after contraction. Without sufficient potassium, muscles can remain in a state of sustained contraction, causing cramps. Nerve impulse transmission. It facilitates the proper conduction of nerve impulses from the brain to the muscles, ensuring coordinated movement and preventing erratic muscle activity. Fluid balance. Potassium is vital for maintaining the correct balance of fluids and electrolytes both inside and outside cells. This cellular hydration is critical. Even mild cellular dehydration can predispose muscles to cramping. Optimal potassium-rich food choices for seniors, and how to enjoy them. Bananas, the quintessential source. A medium banana offers approximately 422 milligrams of potassium. They are soft, easy to chew and digest, and highly versatile. Incorporation. Enjoy sliced in oatmeal or yogurt, blended into smoothies, or simply as a convenient snack. Sweet potatoes, a nutritional marvel. One medium-baked sweet potato with its skin provides about 542 milligrams of potassium, along with valuable fiber and vitamins A and C. Incorporation. Bake, mash, or roast them as a side dish, add to soups, stews, or even make sweet potato fries, baked, not fried, for healthier option. Spinach and other leafy greens. Cooked. While raw greens are healthy, cooking concentrates their nutrients, including potassium. 1 cup of cooked spinach boasts approximately 839 milligrams of potassium. Other excellent choices include kale, Swiss chard, and beet greens. Incorporation. Sauté with a little olive oil and garlic, add to omelets, frittatas, pasta sauces, or incorporate into green smoothies, for those who can tolerate the taste. Avocados, rich in healthy monounsaturated fats and remarkably high in potassium. A whole avocado contains about 975 milligrams of potassium. Incorporation. Slice into salads, mash for guacamole. Homemade with fresh ingredients is best, spread on whole grain toast, or blend into creamy dressings. Oranges and 100% orange juice, a refreshing source of both potassium, about 496 mg per cup of juice, and immune-boosting vitamin C. Incorporation: enjoy whole oranges as a snack. If opting for juice, choose 100% orange juice without added sugars and consume in moderation due to its natural sugar content. Beans and lentils: these legumes are nutritional powerhouses, offering not only significant potassium but also fiber and plant-based protein. 1 cup of cooked lentils provides around 731 mg of potassium, while black beans offer about 611 mg per cup. Incorporation: add to hearty soups and stews, use as a base for vegetarian chili, incorporate into salads, or even make homemade bean dips. Tomatoes and tomato products: fresh tomatoes, tomato paste, and tomato sauce are good sources of potassium. 1 cup of tomato puree can contain over 500 mg of potassium. Incorporation: use in pasta sauces, soups, stews, or enjoy fresh in salads. 2. Magnesium-rich foods, the master muscle relaxer. Magnesium is a mineral of immense importance, involved in over 300 enzymatic reactions throughout the body. Its roles include energy production, nerve function, blood glucose control, blood pressure regulation, and crucially, muscle and nerve relaxation. While calcium is responsible for initiating muscle contraction, magnesium acts as its antagonist, facilitating muscle relaxation. A deficiency in magnesium can lead to sustained muscle contraction and spasms, characteristic of leg cramps. Magnesium deficiency is remarkably common, particularly among seniors, due to factors such as inadequate dietary intake. Many processed foods are stripped of magnesium. Reduced absorption, age-related changes and certain gastrointestinal conditions can impair absorption. Medications, proton pump inhibitors, for acid reflux, and some antibiotics can deplete magnesium levels. Chronic diseases, diabetes, kidney disease, and alcoholism can also lead to magnesium loss. Why magnesium is the calming force for muscles. Muscle relaxation: magnesium directly competes with calcium at binding sites on muscle cells. By occupying these sites, it prevents excessive calcium influx, allowing muscles to relax after contraction. Without enough magnesium, muscles may remain in a hypercontracted state. Nerve signal regulation: magnesium helps to calm overactive nerve impulses, preventing the erratic firing that can trigger muscle spasms. Energy production: ATP. Magnesium is essential for the synthesis of ATP, adenosine triphosphate, the primary energy molecule for all cellular processes, including muscle contraction and relaxation. Adequate energy is vital for proper muscle function. Excellent magnesium-rich food choices for seniors, and how to incorporate them. Nuts and seeds: these are concentrated sources of magnesium. A 1-ounce serving, about 28 grams, of almonds provides approximately 76 mg of magnesium, while pumpkin seeds offer an impressive 156 mg per ounce. Chia seeds, flax seeds, and cashews are also excellent. Incorporation: snack on a small handful daily, sprinkle over oatmeal, yogurt, salads, or blend into smoothies. Nut butters, unsweetened, are also a good option. Dark chocolate, 70% cacao or higher, a delightful way to boost magnesium intake. 1 ounce of high-quality dark chocolate, 70 to 85% cacao, provides approximately 64 mg of magnesium. It also contains beneficial antioxidants. Incorporation: enjoy a small square as a treat, or melt and drizzle over fruit. Whole grains: unlike refined grains, whole grains retain their bran and germ, which are rich in magnesium. Examples include brown rice, oats, quinoa, and whole wheat bread. 1 cup of cooked brown rice offers around 86 mg of magnesium. Incorporation: opt for whole grain bread and pasta, enjoy oatmeal or quinoa for breakfast, or use brown rice as a healthier alternative to white rice. Legumes: as noted for potassium, beans and lentils are also significant sources of magnesium. 1 cup of cooked black beans contains about 120 milligrams of magnesium. Incorporation: integrate into soups, stews, salads, or make bean patties. Avocado, another highly beneficial crossover food. 1 avocado provides about 58 milligrams of magnesium. Incorporation: as mentioned under potassium, a versatile addition to many dishes. Fatty fish, salmon, mackerel, and halibut are not only excellent sources of omega-3 fatty acids, which reduce inflammation, but also provide a good amount of magnesium. A 3.5-ounce serving of salmon contains approximately 26 milligrams of magnesium. Incorporation: bake, grill, or pan-fry, add to salads, or enjoy as a main course. Leafy greens, similar to their potassium content, dark leafy greens like spinach and kale also offer magnesium. 1 cup of cooked spinach has about 157 milligrams of magnesium. Incorporation: sautéed, added to soups, or blended into smoothies. 3. Calcium-rich foods, the balanced contactor, in harmony with magnesium. While often lauded for its critical role in bone health, calcium is equally essential for proper muscle contraction. Calcium ions act as a trigger, binding to proteins within muscle fibers to initiate shortening and movement. However, the delicate balance between calcium and magnesium is key. If calcium is overly abundant or magnesium is deficient, muscles can struggle to relax, leading to prolonged contraction and cramping. Therefore, the focus here is not just on consuming calcium, but on ensuring it's consumed as part of a balanced diet that also provides ample magnesium. Why calcium is crucial, but needs balance. Muscle contraction trigger: calcium is the primary messenger that tells a muscle fiber to contract. It flows into muscle cells, initiating the complex biochemical cascade that results in muscle shortening. Nerve impulse transmission: calcium is also involved in the release of neurotransmitters, the chemical messengers that allow nerve cells to communicate with muscle cells. Important note: it's rare for leg cramps to be solely due to calcium deficiency unless there's a severe underlying medical condition or parathyroid issue. More often, it's an imbalance where calcium is present but magnesium is lacking, preventing relaxation. Beneficial calcium-rich food choices for seniors, and how to incorporate them. Dairy products, milk, yogurt, cheese. These are classic and highly bioavailable sources of calcium. 1 cup of milk provides approximately 300 milligrams of calcium. Yogurt also offers beneficial probiotics for gut health. Incorporation: drink milk as a beverage, low-fat or fat-free options are available, enjoy plain yogurt with fruit or nuts, or incorporate cheese into meals in moderation. Fortified plant milks: for individuals with lactose intolerance or those preferring plant-based options, fortified almond milk, soy milk, and oat milk are excellent alternatives. Always check the nutrition label to ensure they are fortified with calcium, often comparable to dairy milk, and vitamin D, which aids calcium absorption. Incorporation: use in cereal, smoothies, coffee, or as a standalone beverage. Sardines, with edible bones, a surprising but powerful source of calcium. A 3.75-ounce can of sardines with bones can provide over 350 milligrams of calcium. They also offer valuable vitamin D and omega-3 fatty acids. Incorporation: enjoy on whole grain crackers, add to salads, or mash into a spread for sandwiches. Fortified orange juice: some brands of 100% orange juice are fortified with calcium and vitamin D, offering another convenient source. Incorporation: drink a glass in moderation. Leafy green vegetables: certain dark leafy greens, such as collard greens, turnip greens, and kale, provide a decent amount of calcium. 1 cup of cooked collard greens has about 268 milligrams of calcium. Incorporation: sauté, steam, or add to soups and stews. Tofu: calcium-set tofu that has been set with calcium sulfate is an excellent plant-based source of calcium. Look for calcium sulfate in the ingredients list. Incorporation: use in stir-fries, curries, scrambles, or blend into creamy sauces. Beyond diet, a holistic approach to preventing leg cramps in seniors. While dietary interventions are foundational, addressing leg cramps effectively requires a multifaceted approach. Seniors should consider these additional crucial factors. Optimal hydration. Dehydration is a primary culprit for muscle cramps. Even mild dehydration can disrupt electrolyte balance and impair muscle function. Seniors often have a diminished sense of thirst, making conscious hydration efforts vital. Recommendation: encourage consistent water intake throughout the day. Aim for 6 to 8 glasses, 2 to 2.5 liters, of water daily, unless medically restricted. Herbal teas, clear broths, and water-rich fruits and vegetables, like watermelon, cucumber, also contribute to hydration. Regular stretching and flexibility. Tight muscles are more prone to cramping. Gentle, consistent stretching can lengthen muscle fibers, improve elasticity, and increase blood flow, reducing the likelihood of spasms. Recommendation: perform calf stretches, gastrocnemius and soleus, hamstring stretches, and quad stretches daily, especially before bedtime and after exercise. Hold each stretch for 20 to 30 seconds, without bouncing. Moderate physical activity, regular, low-impact exercise strengthens leg muscles, improves circulation, and enhances overall muscle health. Sedentary lifestyles can weaken muscles and make them more susceptible to cramps. Recommendation: walking, swimming, cycling, or gentle yoga are excellent choices. Aim for at least 30 minutes of moderate activity most days of the week, as advised by a healthcare professional. Medication review. Many common medications, including diuretics, for high blood pressure, statins, for cholesterol, beta agonists, for asthma, and even some over-the-counter allergy medications, can cause leg cramps as a side effect or by altering electrolyte balance. Recommendation: seniors should always discuss any new or worsening leg cramps with their doctor or pharmacist. A medication review might reveal a need for dosage adjustment or an alternative medication. Never stop or change medication without medical advice. Heat therapy. Applying warmth to the affected muscles can help relax them and increase blood flow, potentially alleviating or preventing cramps. Recommendation: take a warm bath or shower before bedtime, or apply a warm compress or heating pad to the calves and thighs. Proper footwear. Unsupportive or ill-fitting shoes can place undue strain on leg muscles, contributing to fatigue and cramps. Recommendation: wear comfortable, supportive shoes that fit well, especially when exercising or standing for long periods. Underlying medical conditions. Persistent or severe leg cramps can sometimes be a symptom of more serious underlying health issues, such as peripheral artery disease, PAD, nerve damage, neuropathy, diabetes, kidney disease, or thyroid disorders. Recommendation: it is crucial for seniors experiencing frequent or debilitating leg cramps to consult their physician for a thorough medical evaluation to rule out any underlying conditions requiring specific treatment. By proactively integrating these nutrient-rich foods into their daily diet and adopting a holistic approach to their overall health, seniors can significantly reduce the burden of leg cramps. This empowers them to enjoy greater comfort, improved mobility, and a stronger foundation for their active lives, enhancing their independence and quality of life in their golden years. Always remember to consult with a healthcare professional or a registered dietitian for personalized dietary advice, especially if you have existing health conditions or are taking multiple medications. Sources: